Hey guys, this is Colin with Gordon Physical Therapy. We're talking in our second video here in our running series about iliotibial band syndrome. It's a really common issue for runners and even has the colloquial name of runner's knee. We're going to talk a little bit today about the anatomy, what IT band syndrome is, what are the causes, and then we're going to talk about some specific exercise interventions for prevention of the injury as well as treatment. So I want to talk a little bit about the anatomy. Your IT band is a band of fascia or connective tissue that runs from your hip down to your leg. Basically what it does, it lets the muscles on the sides of your legs that control the reaching out to the side have a little bit more leverage so that they can actually help keep you from tipping over and help lift that leg out to the side if you need to. The pain that comes in from IT band syndrome is usually located just on the outside of the knee, and it results when there's too much load either through that IT band or even friction or rubbing between that band and the lateral part of the femur that can cause inflammation and agitation. So why does this happen to runners a lot? So runners operate in what's called the sagittal plane or front and back. They don't do a lot side to side. And so what happens is runners tend to develop good strength in their quads, good strength in their gastrocs, muscles that move forward and back, but oftentimes have weakness in their hip muscles, such as your hip abductors, like your gluteus medius. And what happens is, as they're running, what can happen is what's called a little bit of a hip drop. And so as they're landing, they get a little bit of a drop to the side, and what that causes is increased tension down through that IT band. There's a couple studies that have looked at this, and there's a positive correlation between hip abductor weakness and IT band syndrome. So one study actually went over and talked about how the majority of runners who had IT band syndrome actually had weakness on that leg of their hip abductors compared to the opposite side, measured with dynamometry. So why is that important? First of all, we know that we can prevent that IT band pain and that IT band friction syndrome by keeping strong through our hips. So runners, it's essential that they not just run, but that they also work on some kind of cross-training, strength training to work in that lateral or frontal plane to prevent those injuries from happening. As far as kind of the frequency that you want to be doing with that, we want to be shooting for probably 2 to 3 times a week, 2 to 4 sets per exercise. And ideally, we're doing something a little bit difficult for you. So shooting for kind of 70 to 80% of what your like 1 rep max would be, or the one time that you could do that exercise. What that roughly translates generally to about 10 to 15 reps for most people too. So what we're going to do is I'm actually going to bring us out and we're going to go through a couple of specific exercises, starting with kind of the easier ones and working our way up, working on hip abductor strength and hip control for prevention of that IT band friction syndrome. All right, guys. So we're going to go over the first exercise here, and the first one, what we're going to do is called a runner's step. Basically what it is kind of a hip control exercise. It's fairly simple to start off with, but you can add some things to make it a little more difficult. So the way this is going to work is you're going to start standing, both feet on the ground, and then what you're going to do is while raising your opposite arm, you're going to raise your other leg, your knee, like you're driving your knee up to the ceiling. The key with this is making sure that as you're stepping up, that one hip's not dropping or leaning the other way, and then you're not getting a lot of movement back and forth in your legs. So you want to be raising your arch, tightening your tummy, and lifting that leg up. So it looks from the side something like this. You're going to hold for a 1 to 2 count at the top. Okay, then you can progress that from there to doing more of almost a lunge into it, coming from back here and up. Maintaining stability. And then the last thing that you can do to kind of make it more difficult is actually add a box that you're stepping up onto to do it. The big key, as I mentioned with this one, is making sure that you keep these pointy parts of your hips that you can feel on the front, called your ASIS, that you keep those level as you're stepping up and down. We're going to show what's called a monster walk or a lateral band walk. So to start off with, you're going to get a band. You can tie a loop or you can buy a loop like this. You're going to hook it around your ankles. And the setup to this is pretty simple. Just get a slight bend in your knee. I'll kind of show you from the side here. So looking somewhat like this, okay? And then what you're going to be doing, I'm going to come get set up over here on the side of the screen so you can see. Fingers on, we talked about in the last exercise, on those pointy part of your hips, your ASIS, because what we want to prevent is we don't want any of our hips kind of going up and down, no dancing as we're going along, okay? We're going to keep right here. Same thing as with that other exercise. We're going to contract that core, bring your belly button towards your spine, okay? And then what we're going to do is we're going to be taking smallish steps, and you'll notice when my feet come together that they aren't coming all the way together. They're coming to about shoulder width apart. Okay, and then it's pretty easy to do the other leg because you can just go the other direction, just like that. Okay, some things you can do to make this more difficult, obviously a heavier band. You can also add a band to your ankles and at about the level of your knees too to get a little bit more resistance. Let's call this the clock drill. Even though I've only got 4 parts on it, you want to kind of get either, you can see I've got some little cones, some furniture sliders, but basically what I've got set up is at 12 o'clock, 3 o'clock, 6 o'clock, and 9 o'clock. And basically what we're going to do to set this up is you're going to step right in the middle kind of your clock that you have set up. And you don't even necessarily have to have targets to shoot for. I think it's helpful though. What you're going to be doing is the leg that you're going to be working actually is the leg that you're standing on. The leg that's reaching is going to be kind of your counterbalance. So if you watch right here as I'm stepping, it's going to look something like this. You're going to want to keep your weight kind of in the middle of your foot. You don't want to be forward on your toes or way back on your heels. It's going to be a nice balanced foot. Same as with those runner steps. We want to be lifting that arch in our foot as we're stepping. Okay? And same thing as the other exercise that we've been doing. We want to have a good core activation and keep our fingers, our hands on our hips, keep them from dropping and moving around too much. So it looks a little something like this. So you're going to be reaching out, tapping that cone, reaching out to the side, reaching back to that back one, and then if you're feeling extra spicy, you can do the other one reaching over and across. That one's kind of hard to keep your hip completely level, especially if you're pretty immobile like I am. Some other things that I need to work on. So that's what it's looking like. And you can see I need some work on this. I'm getting a lot of kind of movement back and forth. This is one that I could probably put into practice a little bit more. Some ways to kind of increase the resistance or difficulty of this one. Obviously increasing the distance away that the cones are. And then another one that you can do to increase the difficulty of this exercise is actually add a little step that you're stepping from so that you're actually getting a little bit of descent each time as you're reaching out to those cones. What we're going to be doing is kind of a form of a side plank, okay? So the setup to this, as you can see, laying on my side, okay? Elbow right underneath where your shoulder's at, hand on your hip, and what you're going to be doing is, to start, coming up, getting nice and straight, good core contraction, okay? And then this is kind of the advanced version. It's a difficult exercise, but I kind of want to show you a progression of some ways that we can go through it. And the next way that you can progress this is lifting that foot up and down. You can see this is a pretty difficult one for me as well. And then the toughest one is getting up and holding that. Okay? So that was our 4 exercises for hip abduction strength for runners. If you liked what you saw, then go ahead and like the video. And if you have any questions, you can put those down in the comments, or if you want to come in and meet us here in the clinic at Gordon Physical Therapy, I or any of our other therapists will be happy to answer any of your questions. Thanks.